All right, Dr. Raja, the data about deaths is encouraging, but as you well know, there's still a lot of debate this week, especially about whether the pandemic may be ending, or is it transitioning, or is it just in a lull before perhaps another big surge? So, what do you have to say about this?
That's a great question, Ben, especially as you said, since there's been a lot of mixed messaging out there. I think the main thing to remember is that we are not done with the pandemic. Whatever term you want to use in terms of a transition or waiting for the next surge, we are not done. Here in Massachusetts, our case numbers are a lot lower than they were in previous surges. But even over the past week, we've started to see a little bit of an uptick, both here and around the country, in terms of infection numbers and hospitalizations. So we are definitely not done with the pandemic yet.
Okay, we know the number of COVID patients overall in the ER may be lower, but are you seeing increases for any other illnesses now that the masks are dropped, maybe the flu? I know we were just talking about this. Allergies are definitely up.
Oh, yeah. Jessica, I definitely feel that. There's a lot going on with allergies right now, which means that there's all sorts of people in New England running around with stuffy noses and itchy eyes. Fortunately, allergies aren't contagious, but when you have those symptoms and your nose is just running all the time, it is still important to take an at-home COVID test to make sure that it's not actually COVID. You asked a great question. We've seen an uptick in flu cases over the past few weeks as well. Fortunately, this past week was the first one in a while where the CDC numbers actually showed a decline. So hopefully that trend's going to continue.
Well, hopefully the New England spring will help us out and we'll get some nicer weather so we can get outside. Allergies aside, but leave flu and COVID behind us, hopefully. All right, we want to ask you about another health alert. This time, Dr. Raja from the CDC asking doctors to report unusual cases of hepatitis appearing in otherwise young, healthy children. Now, the numbers are very small, but what's going on here, and what do you want parents to know about this?
Yeah, so I saw this when the CDC released it last week, and then they had an update today. What we're seeing cases of hepatitis, which is an inflammation or infection of the liver. And we've seen a bunch of cases in Alabama, not a bunch, like 9 cases in Alabama. But there's been cases in Israel and the UK and around Europe as well. They're still trying to figure out exactly what the cause is, but it looks like the patients who develop it also have adenovirus, and adenovirus is usually a GI bug. So if you start noticing that your kids have nausea, vomiting, abdominal pain, fever, talk to your pediatrician like you normally do. But if you start noticing that they get jaundice, so they've got yellowing of their skin or yellowing of the whites of their eyes, if that happens, go ahead and bring them on into the emergency department, because that can be a sign of hepatitis.
Okay, good to know. We also learned today health officials identified the first human case of H5 bird flu in the U.S. Do you think there's any risk for people here?
Oh, I know, Jessica, right? The last thing we need right now is the bird flu. Remember, this avian flu, the bird flu, is a big deal for birds, but it usually doesn't spread that easily to humans. I saw that came out. And so health officials in Colorado found one young man who tested positive for the bird flu and was really fatigued for a couple of days. He got treated with Tamiflu and got better, but they retested him and he was negative. And so what they think is, he worked at a poultry farm and maybe the virus, which was in the chickens, got in his nose, but wasn't actually what made him sick. So they tested him one time, it was positive, but they tested him again right after and it was negative. So they don't even think that is what might have made him sick. So we're not at significant risk right now from this bird flu.
Can't handle anymore.
No, I think that's enough. All right, Dr. Ali Raja at Mass General, have a good weekend. Thanks for your time.
Thanks, Jessica and Ben.